I mean, it's no doubt we are in the era of AI, right?
We're already in it.
We are in it.
Okay.
We are living in it.
Yeah.
I would say AI is just a tool, right? It's the hammer and anvil of our era. How we use the hammer and anvil to then create more tools is really where the magic is going to happen, right? How can we use a hammer and anvil to create the next shield to prevent us from a pandemic, for example, right? That's really where the magic is going to happen.
We spend a tremendous amount of time collecting the dots. We need to spend just as much time in connecting those dots. And that's what Public Health Connects is all about. My name is Dr. Umair Shah. I'm the Secretary of Health for the great state of Washington. This is Public Health Connects. Hello and welcome to Public Health Connects. My name is Dr. Umair Shah, Secretary of Health for the great state of Washington, and I'm so glad you have all joined us for our third edition of Public Health Connects. As you will recall, our first episode was with Abigail Echohawk, and we were speaking about equity and data genocide. Our second episode was Dr. Kate Starbird with the University of Washington, and we talked about engagement, information, misinformation, and social media. Today, our episode is focused on innovation. And in particular, we're going to be talking about AI and how it's transforming or potentially transforming both health, public health, and the healthcare systems together. I am so excited to be joined by Vidhu Shekhar, who is Microsoft's government strategy leader within Microsoft's worldwide public sector organization. Let's get started. Thank you so much for being a part of our conversation today. This is such an honor for us.
Thank you, Dr. Shah. I'm super excited. Love the work you guys are doing up here in Washington State, and so glad I could be a part of it.
What is generative AI, and how should health be thinking about this? Let's talk about what is generative AI.
You know, at the core, the difference becomes when we looked at AI previously, we were trying to solve a transaction, right? Okay. Just a point-to-point transaction. There was a machine learning component. If you teach the machine enough number of times how you could do that transaction,
it'll do it.
It'll learn how to do it.
Right.
Right. If you show enough number of spam emails, it'll know to block the spam emails. Right.
Got it. Or spell check on our phones, right?
Exactly. Exactly. Even though I hate sometimes how it changes certain words.
About that,
Right.
There's been an update lately on one of the products. I won't mention which of the phones, but I'll tell you, it gives me spell check instability. Is what I call it, because now all of a sudden words that are supposed to be like incredible, it actually wants to spell it incorrectly, and I'm like, no, don't do that. And I invariably I always hit the wrong button.
So what generative AI really does is it's based on a foundation model. And that foundation model is built on enormous volume of data, right? In the context of like OpenAI, GPT 3.5, for example, was built on about 175 billion parameters.
175 with a B?
With a B.
Wow.
And then came GPT-4 with 170 trillion parameters.
Oh my gosh.
Right? So think about it in the context of a high schooler, right?
Yeah.
It's like going through a K through 12 education.
Yeah.
And that's your foundation model. When you come out of K through 12, you can still do a lot of things.
Absolutely. Yeah.
And then you can choose to specialize. Right? And that's where these, learning models can be built on top of that foundation model with generative AI that are specialized in public health, for example, or other government services, or healthcare from a clinical perspective, right? And that's really where the capability of this tool lies. So in many ways, AI is not a robot.
Yeah.
I would say AI is just a tool, right? It's the hammer and anvil of our era. How we use the hammer and anvil to then create more tools is really where the magic is going to happen, right? How can we use a hammer and anvil to create the next shield to prevent us from a pandemic, for example, right? That's really where the magic is going to happen.
So we're hearing generative AI is being at least compared to the internet or the industrial revolution. I mean, there's a lot of loaded terms that are being used here. How would you describe all of this and help make sense of that for our audience?
I mean, it's no doubt we are in the era of AI, right?
We're already in it.
We are in it.
Okay.
We are living in it, right? We are seeing it used everywhere, right? And specifically when you look at the public health landscape, we're going to start seeing a ton of usage, right? We're going to see how disaster response and recovery coordination changes, right? We're going to start seeing public workers, health workers being able to actually use generative AI for note-taking, note compilation, right? We're going to start seeing a gathering of public sentiment and analyzing it in a way that we can actually engage better with the public, right? We will see the community needs that's presently in like spreadsheets, hundreds of columns of spreadsheets. How do we, go through those data sets and actually surface those insights, right? We will start seeing a lot of the predictive analytics, sort of the holy grail of population health management, right? How do we get to that? I think generative AI is sort of the door opener. And of course, I mean, the nuts and bolts of generative AI lie in document generation and analysis.
Absolutely.
Right? We will certainly be able to do that.
Yeah. There's a lot to learn. So this is where the challenge is. I always say to our team that our competition isn't the other 49 state health departments or agencies out there. Our competition is ourselves. We want to be the best that we can be at adopting technology, working to develop technology, and implementation of that technology so it allows our people to be successful in serving the people that they're serving. That's what it's all about. That's been a challenge because, again, this pandemic has just been so relentless in how it's impacted our field. Where do you see our field being in public health? Are we early in either adopting or being facile with this? Are we late to the game? What would you tell our audience about how this is looking in our field of health?
Health, when it comes to technology, cannot be right at the forefront. And I think it's a very fine balance, which you guys are doing really well, of keeping it sort of right in the middle of the pack while trying to adopt it at the earliest possible place once it's addressed all of those risk management concerns, right? And so I love the momentum that's going on across the board, right? Even if I look at all the way west on the Hawaiian Islands, they have put out some new technology to help folks being able to enroll in Medicare and Medicaid programs.
How do you protect the bad actors from being able to get into a system and cause havoc? And I'm thinking about a lot of these movies, like the Bruce Willis movie where maybe all the traffic signals were like changed out and all of a sudden all the cars are crashing and I'll be like, oh my gosh, what's happening? The end of the world.
Bruce Willis always gets in trouble.
There's always something that happens. Any Bruce Willis movie, you've got to be really. So
Yes.
how do you protect the bad actors from being able to get into a system and cause havoc?
Right when we started off on sort of getting into technology, right? Early on in the 60s and 70s, very early on, we realized that just the way technology can be used for good, it can be used by bad actors for the wrong reasons, right? And there has been a massive, massive push for cybersecurity, different aspects of security, application security, all of that.
At every step of the way.
At every step of the way.
Got it.
The current generation of AI that is being used in most places is neither artificial nor intelligent. And the whole notion behind that was, well, it's not artificial because we are creating it, and it's not intelligent because it's just doing a task.
Interesting.
It's replicating the task that was designed and put in place by a human. So there is no intelligence behind it.
Got it.
Right? That's going to change, and that's going to shift very drastically, maybe in the next decade. Us being scared of that is exactly where the regulation and the notion around how do we put guardrails around this comes in.
Got it.
Right? And this is where, if you see, where the regulation is kind of headed, right? I mentioned around critical infrastructure specifically. I think, yes, we should think about proactively, what does that mean? Do we leave the load balancing for the grid onto an AI? Do we leave, the oxygen balancing in the hospital system to an AI? Right?
Got it.
And not to sound, all doomy and gloomy about it, but this is where I think the human in the loop concept becomes absolutely critical.
Do you see a world in which the human element gets pulled out of that loop? Do you see that?
Not in my lifetime, I don't think so.
Okay.
Yeah. Not that I'm saying I'm really old, but I really think the human in the loop for the foreseeable future is going to be the way.
Let me shift a little bit. In our audience, as you know, in public health and healthcare, that whole ecosystem is very mindful of equity concerns, equity issues, diversity. People who are oftentimes left out of the, they're not at the table. They're not for whatever reason, they're not invited. Or the technology goes so fast, and there's a cost to implementation or adoption, and they're nowhere to be found, and communities are left behind, right? And we feel oftentimes that in health that we've got to take equity and balance and make sure that equity is for at the forefront. And yet with technology adoption, it oftentimes become inequities that start up. How do we ensure inclusiveness, the diversity of voices, communities that are left behind or left out, that are not at the table? How do we ensure that, or what kinds of steps are you in this field taking? I know you're representing the entire field today. You're the person representing the entire field. What are the steps that are being taken to make sure that inclusivity is part of that?
It is top of mind for everyone, right? There is the notion around bias. There's the notion around algorithmic bias that folks want to make sure gets addressed. Right? Perhaps the number one way, I sort of think about it personally is we have to just get more people on the table. More people that don't think like me, more people that don't look like me, people who are different in every single way.
Got it.
Right? Because while this is a technology issue, really, it's an issue within the science of this, or whether you think about it from the lens of you coming at it from a healthcare perspective, but we need someone from the policy perspective.
Got it.
Right? To balance it out. And that's why, you're absolutely right. We need more people at the table. And we have to create that space. Right? So that's the number one place we have to start from, is just creating that space.
And that's happening.
And that is happening.
That's happening.
It's happening at multiple levels, right? Whether we look at happening in private sector companies like Microsoft, right? Or whether we look at how the federal government is kind of encouraging folks to get together. I'm also part of a NIST public working group. And so they are bringing folks together to make sure that the voice is heard from different directions.
Got it.
And that feedback is incorporated into all sorts of things, into standards, into policies, so forth.
Including language, preferred language, right? Because there are many communities that there are certain languages that they're markedly more comfortable with, and as you and I have a background, and we know people back home that obviously, English is important, but I feel a lot more comfortable in other languages.
In this large language model, the benefit of it being so large is because then now you have these different reference points. Think about it, the linguistic, challenge that comes with just translating something, as opposed to if you have the colloquial references, right, you're able to pick it up much more easily.
Got it.
Again, making this personal, right? My wife is Japanese, and we talk to our kids. I talk to them in English. My wife talks to them in Japanese. For certain things, I had to learn Japanese because the way I would talk to my kids would come off as really rude in English. But that was not my intent. And this can be taken in so many different ways, especially in the context of public health.
Yeah.
You wanting to have the population come and get a vaccine can be interpreted in so many different ways. We saw that happen during the pandemic. Right? How do we meet them where they are?
Yeah.
And AI can be a tool for that.
So I'm going to shift, but I want to ask, when your wife is upset with you, what language is she speaking?
Anybody's guess at this point. That's part of the reason I learned Japanese.
I hope you're watching, so make sure that we are making sure that we know that Vidhu is absolutely speaking and learning Japanese for the right reasons. So we want to make sure that home accord here. A panelist on one of our previous Public Health Connects talked about rumors in the middle of emergencies, right? And AI can generate so much good, but can also advance so much in terms of bad when it comes to information or misinformation. How do you see this play out in emergencies? And how would the AI tool be utilized in a way that is helpful for what we're trying to achieve in responding to an urgent issue?
I'll build on the disaster in Maui. Right, and in fact, last month, our president Brad Smith was doing a testimony in front of Congress.
Yeah, Brad's a fantastic leader.
Absolutely, and he shared that beyond just us responding to the fires, there was a ton of misinformation going on from state actors, simply around the notion of don't trust the government that's coming in to help you. Right. Again, from the lens of at Microsoft, we were able to identify it and flag it. Right? So that's one way where it's becomes very real. You think about it as conceptually this could happen, but it is actually happening. We also have a great AI for Good team that within hours of the fires happening was able to look at satellite data and run damage assessments. In fact, we were able to help the team on site there with some of these reports, just giving it to them, because this accelerates the way damage assessments can be done and eventually get help to the people who are just dealing with all sorts of things on the ground, right? And so we have to sort of flip the script in terms of making sure that at the core, any disaster that happens, one, we need to make sure that the recovery and response activities happen ASAP. Right.
Yeah, time is of the essence.
Time is of the essence.
Time is lives. Yeah.
And I mean, it really, even before the disaster happens, how can we look at leading indicators, weather or otherwise, right? Flooding is a good one where you can kind of predict to a fair degree of certainty what the weather pattern is going to reflect and how the flooding is going to happen in a certain area. So how do we look at AI to help with some of those things so that then we can plan better? We can respond to some of these things better, whether it's about getting folks the right evacuation routes, telling them to actually move away from certain floodplains rather than moving towards those floodplains, defining better.
And I know this well, being in Texas previously, there was so many hurricanes and floods that we were dealing with. And here in Washington as well, in California, it's that I think the one certainty about emergencies is that you're going to have another one. And that's the challenge that we have. And so trying to provide information to be able to help people get to good health or well-being or protection versus going in the opposite direction, as you mentioned.
Exactly. Is key. And then when, we are also seeing other use cases around this, right? When folks are in those, response and recovery centers, they barely have a bag on them. Yeah. And most folks ask for, give me your ID, give me your, proof of something before I can even help you. And that's perhaps where AI can help in streamlining some of those things.
Got it.
Where we are able to provide assistance in the fastest way possible.
You mentioned something that really struck me about humanity, the humanity of the whole community, but also the whole person, right? How do you see AI playing a role in this whole person view of physical, nutritional, emotional, spiritual health? Spiritual always gets thrown to the back of the line, and emotional gets thrown to maybe the second back of the line. We don't even think about sleep. We don't even think about some of these other aspects of health. How do you pull this all in and say, I want this tool to not just be talking about diabetes and high blood pressure, but I want this tool to be talking about mental and emotional and behavioral health in a way that's going to really be successful for the whole human being that we're dealing with?
And I mean, to be honest, and sorry to disappoint, I actually don't have an answer for that yet. But I look at it from the lens of if you look at just the Maslow hierarchy of needs, right, some of the basic needs have to be met for us to be able to kind of go up in the hierarchy. AI is at the same point where it's looking more at those basic aspects, right? And when we look at something like the challenges that we are facing in public health in general, right? How can we look at those different policies? How can we look at those different data sets and bring them together? Because then we can actually look at the problem and look at it from a lens of not solving a particular problem at a given time,
right,
but look at if we solve this problem in a slightly different way, we can address 2 other problems. And maybe we actually need to go back, the value add, right? Maybe we actually need to change the policy just a little bit to be able to solve 4 of the problems. Right? We have to use that as a tool, AI as a tool, to help highlight these issues. Right? My personal opinion still remains, there is going to be significant work that needs to be done on the AI front for it to get to the point of, having that emotional, I don't even, claim to have any expertise in either the emotional or spiritual side of things. Right?
I'm not sure about that, but
but I'm going to say, right, to me, certain things like emotions and spirituality are human traits. Right? And this is why I think, human-centered AI is the way, right, where we help the human look at a vast amount of data, but to get to the point of meeting the other person in a way that's completely empathetic, as opposed to looking at AI to meet that person in a completely empathetic way.
I got it.
Right? There is nothing that's going to replace the face-to-face interaction. Me sitting here across from you is way more valuable
than a virtual meeting or by phone,
or you talking to ChatGPT
or ChatGPT,
right?
Yeah,
exactly.
Absolutely.
And I think there is no substitute for that. Right? And so, if I have to leave you with any sort of last thoughts, I'm going to say the way we can approach sort of human-centered AI is going to be the key, and it's going to be defining in terms of how this technology rolls forward, just for the betterment of mankind.
I'm struck by, I always use the word, in fact, part of our Public Health Connects has been that we are so good at collecting the dots, we need to be markedly just as good, if not better, at connecting the dots.
Absolutely.
So I love this. So Vidhu Shekhar, thank you so much for being a part of this. Thank you for being here, talking about AI, talking about public health, healthcare, the health ecosystem, as well as government, and how do we work together in this. And thank you so much for the opportunity.
Dr. Shah.
It has been such an honor and pleasure. I'm sorry, Mike. As I said at the beginning, I am not an expert in this field. This is where people like you, like Vidhu Shekhar, who comes in from Microsoft, who really provides us the insights into how we can be successful in the work that we do. I can't say enough about this conversation. Thank you so much for being here.
Thank you to you. And like I said before, thank you to the Invisible Heroes.
Thank you. Thank you for saying that. And to all of our viewers for Public Health Connects, I hope you enjoyed this conversation. Thank you so much for tuning in. We hope this in-depth discussion about AI and the impact on all of us, but in particular the health ecosystem, has provided you just incredible insights. I learned a tremendous amount. Remember, Public Health Connects is not just about collecting the dots, but connecting those dots and the convergence of equity, innovation, and engagement so we can make a lasting difference in the lives of our communities and also the people who serve those communities. Thank you so much, Dr. Umair Shah, signing off until next time.